Good morning, everyone. This is Dr. Susan Mera with Dr. Mera's Medical Minutes. And today we're going to talk about Morgellons disease. What is Morgellons disease? Morgellons disease is a dermatological manifestation of tick-borne illness. And typically the patients have Lyme, relapsing fever, Bartonella, and maybe Babesia. They might also have some mold present. And what happens is the patient develops very large, painful lesions on their body. And out of these lesions are very strange, colorful fibers. They're blue, white, red, black. And those fibers are very difficult to remove from the lesion. We believe that they stem from the keratinocytes in the skin, and there's probably a genetic component to it as well. We don't know. We honestly do not know what the cause of Morgellons is at this time, which is very unfortunate because it's been looked at by Ginger Savely, Ray Stricker, and the Charles E. Holman Foundation for 25 years. I'm pretty sure Ginger's been doing Morgellons for 25 years. And it's just not well accepted at all. And it's very painful. It's very disfiguring because the lesions can become very large and very deep. And it's also really difficult to treat, very difficult to treat. You basically have to use heavy-duty antibiotics continuously to get the lesions, and also use antiparasitics to get the lesions under control. The lesions they can be itchy, they can be painful, and the other thing in Morgellons patients is a lot of them have issues with infections in their teeth and jaw. So that's also really interesting. The other infection that causes that is Bartonella. So Ginger Savely thinks that Morgellons is a combination of Lyme, Bartonella. The patient may have, been exposed to something very dirty in the environment, like in the soil, that's gotten under their nails or their skin and is the initiator of infection. How do you treat Morgellons? Well, you use a combination of antibiotics, for example, doxy, zithromax, rifampin, and ivermectin, or Mino, Zithromax, Bactrim, and ivermectin. Sometimes you're going to need to use an antifungal like itraconazole, maybe even diflucan for yeast. And you're going to have to treat them for a very long time. And the wounds will gradually get better, very gradually. So some nutritionals and herbals that you can use are MC Bar 3 by Beyond Balance. That seems to be very good for Morgellons. And there's a host of other things like vitamin D, quercetin, curcumin, resveratrol, things like that can help heal the wounds. Also, you might be able to use topical dapsone, although it's very, very expensive, and topical metronidazole, although that too is expensive. So they're not perhaps the best solution, but they may be helpful. Everybody is wondering whether or not Morgellons is contagious. We don't think that it is. In other words, the the lesions that happen in Morgellons, the fibers that are coming out, they are not contagious from one person to the other. So if you touch it, you're not necessarily going to get Morgellons. So that's really helpful to know, that you can be around Morgellons patients and not contract it. So I hope that this little video has been helpful to people in regards to finding out about Morgellons. And I hope you have a wonderful day. Thank you.